Welcome back. In this section, we're going to start learning about some of the external structures in the male reproductive system. And so we're going to start with the scrotum. So the scrotum is hair-bearing skin that tends to be a little bit darker in coloration than skin elsewhere in the body. And just deep to the skin, you have a layer of muscle, smooth muscle. So it's involuntary, and this muscle is named the dartos muscle. We'll talk about the dartos muscle again shortly. Inside the scrotum, there is a layer of fascia which actually divides it in the center. There's a septum so that the contents on the right side are completely sequestrated from the contents on the left side. And yes, as the picture shows, the left testis is usually lower than the right one. Now, the reason why the testes are outside of the body in the scrotum is because the ideal temperature for sperm production, yes, to get her pregnant, is significantly cooler than your core body temperature. So if you recall, the testes are formed the same place that the ovaries are formed. And that is about 5 degrees warmer in there than it is out here. So these testes, they start their migration near the end of the first trimester, where they'll move from their location in the abdomen further down in the abdomen pelvis area. And then near the, in the third trimester, they will then migrate externally through the inguinal canal into their normal adult location. So looking at this drawing, you can clearly see the skin, and then you see the fascial layer, which is going to divide the testes with its septum right here in the middle. And then you can see the beautiful dartos muscle. So the testes itself should be examined periodically, just like ladies do monthly self-breast exams. Gentlemen should be doing the same thing with their testes, especially when they're young. Because testicular cancer is one of the most curable kind of cancers if found early. The testis itself has a tough white covering made of dense connective tissue called the tunica albuginea. And then fibers from the tunica albuginea penetrate through the testes to form septae, so that the testis itself is divided in about 350 different little compartments. Now, they're not completely isolated from each other, because at the hilum part of the testes, the tubules that are inside each of these compartments, they all kind of merge together. So inside each of these little compartments are these seminiferous tubules. And so there is one, maybe up to a half a dozen of these, and each of these are 6 feet long. So all the way from this fingertip to that fingertip, from fingertip to fingertip, that is 6 feet long. So you gentlemen have about 1,000 of these tubules in your testes. So let's look for a second at the seminiferous tubule. This is a beautiful scanning electron micrograph, and then here is a regular light micrograph. And there are 3 different cell types related to the seminiferous tubule. Okay, there may be more than 3 distinct types of cells, but they fall into 3 general categories. And the first are important cells that are not inside the seminiferous tubules, but are between them. Okay. That's not the ones I want. Starting with the bottom one. So the ones between them right here are called interstitial cells, and are also known as Leydig cells. And those are these cells that you clearly see between the seminiferous tubules. The second type of cells are the germ cells, the ones that will eventually become sperm. And in fact, every single day you have 85 million of these gentlemen, which are dividing and on their way. I guess 85 million little sperm a day is what you need in order to get her pregnant. And the third type of cell It's called a Sertoli cell or a sustentacular cell because this is a support cell for the germ cells. Without these, germ cells would die off. So we're going to talk more about the different types of germ cells and the function of the Sertoli cells and interstitial cells. But right now, just realize there's 3 different categories of cells. So getting back to the testes. So the seminiferous tubules all go towards the hilum of the testes, and each little compartment, they all join together. So there's one straight testis that exits each little compartment. And then these kind of form a plexus called the reedy testes. And from the reedy testes, there will be efferent ductules, which will lead into the epididymis. So when we look at the efferent ductule, there's actually 2 different types of epithelium. Some of the epithelium is ciliated, and that's because cilia create external currents to move stuff along, and what they're moving along in this case are the sperm. In other words, those sperm, they're not doing any work whatsoever until they are outside the body. Okay. Now, in addition to the ciliated columnar epithelium, there are also cells that aren't ciliated, which absorb excess fluid, which is produced when the sperm are produced. So then we move to the epididymis, which is comma-shaped and starts superiorly to the testis and then goes posteriorly. So it has like a head, a body, and a tail on it. Inside the epididymis, there's only one duct. It's significantly larger, and it's about 20 feet long, all coiled up. And once again, it's going to have pseudostratified columnar epithelium that's ciliated and has long microvilli. Now, it takes sperm about 3 weeks to make its way through the epididymis. I like students to think of the epididymis kind of like kindergarten, okay? So technically the sperm are made in the testes, but they don't know what to do. So they come to the epididymis and they learn the breaststroke and the side stroke and the backstroke. They learn how to swim. Okay, they don't do any of those strokes. They do kind of a sidewinder thing. But that's okay. So sperm can be stored here up to 60 days. It doesn't take them 60 days to mature. It only takes them about 3 weeks to mature. But if they're not called to duty, they're going to hang out here. And then if they're never called to duty, this is where they undergo apoptosis, that pre-programmed cell suicide. Because remember, your body's making 85 million of these a day. All right. If they're called to duty, they will then travel into the vas deferens, which is a tube which is going to lead from the scrotum through the inguinal canal and into the pelvis of the male posterior to the urinary bladder. Now, the vas deferens is a very thick-walled tube. As you can see, it has dozens of layers of smooth muscle, which means it's great at peristalsis, which is its job during ejaculation. When you look at the vas deferens up close, you can see that, yes, the sperm are going to travel in the lumen, and there is a beautiful epithelial surface with these lovely long structures. So, the blood supply to the testis comes from testicular artery. And then, as you learn in lab, there is a testicular vein. However, it's not an artery going like this and a vein going like that. If we were to take the hot arterial blood from your core and dump it into the testes, well, then the testes would be hot and the sperm would be cooked and they would not form. And there would not have been much point for the testes to migrate away. So what happens is, the venous drainage of the testes, starting at the testes, is not a single vein, but instead it is a plexus of veins known as the tympaniform plexus. And this completely surrounds the artery. So it is bringing cooler blood back up into the body. And so, just think what happens if you, take a wine bottle or a water bottle and you stick it in ice water. It's going to get cold. Okay. So this pampiniform plexus is pre-cooling the arterial blood. So it is not at your core temperature when it reaches the testes. And so here is an example. When it leaves your body, it's at about 102 degrees, but by the time it reaches the testes, it's down to 94 degrees. And then by the time we have venous blood leaving the testes, it is down to 91 degrees, but due to the transference of heat here in the spermatic cord, it will be up almost to core temperature by the time it gets back into your core. So talking about these testicular arteries and veins, it's important to realize the testicular artery, even though it's going to your groin area, does not come off of any of the iliac vessels, not the external or the iliac or the common. It comes off the aorta before the aorta bifurcates. And the testicular vein is also very interesting. If you recall, there's only one blood vessel that crosses from the left side anterior to the aorta to get to the right side, where the inferior vena cava is. And of course, there's none that go posterior to the aorta because that's where your spine is. And the only blood vessel that crosses anterior to the abdominal aorta is the left renal vein, which means the left testicular artery cannot cross in front of the aorta. So the left testicular, did I say artery? I meant vein. The left testicular vein drains into the left renal vein, which then crosses, whereas the right testicular vein drains directly into the inferior vena cava. So just to review the inguinal canal, we have some openings and a tunnel in the epineuroses of the abdominal wall muscles. Superficially and medially, you have the superficial inguinal ring and the epineuroses of the external oblique. And then on the deep side and more lateral, you have, over here on this side, showing it better, you have the deep inguinal ring and the epineuroses of the external oblique muscle. And between the two, the tunnel is known as the inguinal canal. And that's what allowed the testes to leave the abdominal cavity and also allows the sperm to re-enter through the vas deferens. So let's look at that spermatic cord and learn some of the structures in there. There are many layers, all related to layers that were in the abdominal wall. For instance, when structures came through the abdominal wall, they dragged peritoneum with them. In addition, this red muscle here is the deepest. It's the transverse abdominis muscle, and that brought a fascia layer. The orange, the external oblique muscle, that brought a fascia layer with it as well. But the internal oblique muscle, this gray muscle, it actually traveled as muscle into the spermatic cord down into the scrotum. So you can see that here where the internal oblique is bringing fibers which travel inferiorly through the spermatic cord. And this muscle, when it's in the spermatic cord and in the scrotum, is no longer called the internal abdominal oblique. Excuse me. Excuse me, they mowed my grass this morning and making me sneeze. So the internal oblique muscle in the spermatic cord and the scrotum is renamed as the cremaster muscle. Now, in addition, there are going to be blood vessels, there's going to be the vas deferens, and there are going to be nerves in the spermatic cord. So looking at these layers inside the scrotum to realize that everything is getting brought down, if we did a cross section through the scrotum, on the outer side, we would have the skin. Deep to the skin, we have the dartos muscle, which is sometimes called the tunica dartos, but most people just call it the dartos muscle. We have remnants of the external oblique and transverse abdominis muscles. And then we have the cremaster muscle, which are fibers from the internal oblique muscle. And then lastly, surrounding the testes itself, we have the tunica albuginea. So those are the three important structures that we have learned about. So the dartos and cremaster muscles, why do gentlemen have them? What function do they serve? Well, in cold temperatures, both of these muscles will contract and pull the testes closer to the body, so they will stay closer to that ideal body temperature. But in hot weather, like when women are swooning, then what happens is the dartos and cremaster muscles are swooning too, and they relax, the skin of the scrotum unwrinkles, and the testes drop to cool the testes to keep them at a more optimal temperature. So clinically, there is relevance because there's this reflex called the cremasteric reflex, where if the inner thigh is stroked, that causes the cremaster muscle to contract and the testes rises up. So this is just a neurological reflex along with all the neurological reflexes that you're going to learn about in the physiology component. So with that, just take a moment, pause the slide, and make sure that you can identify all these structures on both a coronal view, a parasagittal view, and just an anterior view of just the organs. And with that, I want to thank you, and we are done with this section on most of the external genitalia.